Questioning is a simple retrieval strategy that can be used in any teaching environment. And you can use an opening question that starts off the session with an immediately focusing event. It gives you an opportunity to set the tone. It sends the message that your teaching style will be interactive. And it allows you to gauge the initial interest level of your learners. And it can also be helpful to know immediately if your learners are receptive, neutral, or even a little hostile to what you're going to be teaching. An opening question is usually best to make that something that anyone can answer. So an example of that might be something like, who remembers one of the 3 methods of disposing of lab samples we discussed last time? You can use opening questions to reference prior learning. You can use it again as a temperature gauge of the learner's knowledge of the content and to get them focused and engaged in critical thinking. Another type of questioning that you can use at any time during your teaching is Socratic questioning, sometimes called pimping in medical education. So that would be a question like, what can you tell me about cardiomyopathy? Notice that the learner can give a definition, they can talk about symptoms, they can talk about treatments, or whatever else they can think of. There's lots of right answers. You can also use a closing question to close out your session, to summarize learning from that day by asking something like, what are the key things to remember from today's session? Note again here, there isn't any one right answer. There are just a number of key takeaways that you may want to summarize.